atrophy. What is meant by the atrophy? First, we will see the definition of atrophy. What is atrophy? It is the reduction in size of organ or tissue due to decrease in cell size and number. In the atrophy, there is decrease in the cell size as well as there is decrease in the cell number. So, because of decrease in the cell size and number, there is reduction in the size of an organ, affected organ. Then atrophy is of the two types. That is physiological atrophy and pathological atrophy. What comes under physiological atrophy? During normal fetal development. During normal fetal development, some embryonic structures such as notochord and thyroglossal duct undergo atrophy. Okay, what is physiological atrophy? Some embryonic structures, that is the notochord and thyroglossal duct, undergo atrophy during the normal fetal development. Then what is the pathological atrophy? The pathological atrophy has several causes. What are the causes of pathological atrophy? The first one is disuse atrophy. What is disuse atrophy? For example, when there is a fracture of bone. Okay, when there is fracture of bone, bone is fixed in the plaster cast and patient is completely otherwise bed rest. Then it leads to atrophy of skeletal muscles. Okay. When disuse atrophy, whenever there is a fracture of the bone is fixed in the plaster cast. So there is no there is no use of the skeletal muscle. So there is atrophy of the skeletal muscle occur. This is the first cause of the pathological atrophy. Then second cause is denervation atrophy. As the name suggests, denervation, it is related to the nerve. Normal function and metabolism of skeletal muscle depends on its nerve supply. Okay. But whenever there is damage to the nerve, there is atrophy of muscle fibers supplied by that nerve. Okay. This is the second cause of pathological atrophy, that is the denervation atrophy. Normal functions and metabolism of the skeletal muscle depends upon the nerve. But whenever there is a damage to the nerve, then there is an atrophy of the skeletal muscle fiber that is supplied by that nerve. Then third cause is the senile atrophy. What is senile? Senile means age-related atrophy. For example, due to aging, there is atherosclerosis. Atherosclerosis is also aging process, na? Aging that causes the atherosclerosis, which leads to decrease in the blood flow. So there is ischemia. So there is atrophy of mainly brain occur. That is the senile atrophy. The third cause of the pathological atrophy is the senile atrophy. Due to the aging, there is atherosclerosis, decreased blood flow towards the brain, so it causes the brain atrophy. This is the senile atrophy. Then fourth cause is inadequate nutrition. Inadequate nutrition. Whenever there is severe protein energy malnutrition. When there is a severe protein energy malnutrition, body utilizes muscle protein as a source of energy that leads to atrophy of muscle fibers. Atrophy of muscle fibers. Second, whenever there is any chronic inflammatory disorder, cancer like condition is there, then there is chronically overproduction of cytokine, that is tumor necrosis factor, which causes appetite suppression, lipid depletion, that leads to atrophy. Okay. So, in case of the cancer condition, which factor is responsible for loss of weight and which factor is responsible for cachexic condition? In case of the chronic inflammatory disorder such as tuberculosis, in cancer condition, that factor is the tumor necrosis factor. The tumor necrosis factor is responsible for weight loss and appetite loss as well as cachexic condition in chronic inflammatory disorders and in the cancer patients. Then fifth one, it is the loss of endocrine stimulation. For example, in the post-menopausal woman, there is estrogen deprivation. So there is loss of estrogenic stimulation is there. So that leads to atrophy of breast, vaginal epithelium and endometrium. As the postmenopausal woman, there is a loss of estrogen deprivation. It is a physiological condition. But this point is described under the pathological atrophy in the Robbins. I don't know why this point is mentioned under the pathological atrophy. Normally, it comes under the physiological atrophy. Then sixth one is the pressure atrophy. Then sixth one is the pressure atrophy. For example, when there is a enlarging tumor mass, okay, enlarging tumor mass, which causes the pressure over surrounding blood supply. So there is atrophy of surrounding uninvolved tissue. Okay, these are the various causes of pathological atrophy. Once again, I revise. Atrophy means reduction in the size of the organ and tissue due to decrease in the cell size and number. Atrophy, that is decrease in the cell size and number. Physiological atrophy, during the normal fetal development, there is some embryonical structure such as the notochord, thyroglossal duct undergoes the atrophy. And pathological atrophy, there are several causes responsible for the pathological atrophy: diffuse atrophy, denervation atrophy due to the loss of nerve supply, senile atrophy due to the aging process, inadequate nutrition, loss of endocrine stimulation, and pressure atrophy is there. Then coming to the actual mechanism of atrophy. Mechanism of atrophy. Mainly atrophy occurs because of the three reasons: decreased protein synthesis, increased degradation of protein, and third one is autophagy. These three factors are responsible for the atrophy. Among these three factors, this increased degradation of the protein, this factor is very important, and that causes the atrophy. Normally, in our body, the cellular protein, degraded by, there is one pathway degraded by ubiquitin proteasome degradation pathway. Okay, whenever there is accumulation of cellular protein is occur to prevent the misfolded formation, so the cellular protein is degraded by ubiquitin proteasome degradation pathway. But whenever there is nutritional deficiency, whenever there is disuse is there, then there is increased activation of this pathway. Increased activation of which pathway? Ubiquitin proteasome degradation pathway. That leads to activation of ubiquitin ligase enzyme. That leads to activation of ubiquitin ligase enzyme. What is the functions of ubiquitin ligase enzyme? That enzyme causes attachment of ubiquitin to cellular protein. Ubiquitin to cellular protein. That leads to formation of ubiquitin plus cellular protein complex. Okay, when these complex taken up by proteasome, it causes its degradation. So that leads to atrophy. And when ubiquitin cell protein complex is taken up by double membrane bound autophagosome, then lysosomal enzyme present in it induces its degradation. That leads to atrophy. This is the mechanism behind the atrophy. The mechanism of atrophy is very important. I again repeat, normally in our cellular protein, where there is degradation by ubiquitin proteasome degradation pathway occur to prevent the misfolding protein accumulation. But whenever there is any nutritional deficiency or disuse is there, then there is increased activation of ubiquitin proteasome degradation pathway. And when these pathways get activated, then it leads to the activation of ubiquitin ligase enzyme. And this ubiquitin ligase enzyme causes the attachment of ubiquitin to the cellular protein. Then there is complex formation is there. Which complex? That is the ubiquitin and cellular protein complex formation is there. And when these complexes taken up by the proteasome, then it leads to the degradation and causes the atrophy. And when these complex is taken up by the double membrane bound autophagosome, the lysosomal enzyme present in the autophagolysosome, which induces its degradations, that leads to the atrophy. The third mechanism is the autophagy. As the name suggests, autophagy means eating its own content. Eating its own content. Due to eating its own content, there is increased number of vacuoles and some amount of cell debris present inside vacuoles which resist digestion. ये digestion के लिए resist कर रहा है, so it remains inside the cytoplasm as membrane bound residual body. One example, one most important example is lipofuscin granules. It gets accumulated in the heart and that leads to brown atrophy of heart. Okay, these three mechanisms contribute to the atrophy. In decreased protein synthesis, increased degradation of protein, and autophagy. So, ubiquitin proteasome degradation pathway plays an important role in the atrophy. Okay. This is all about atrophy. Definition of atrophy, that is reduction in the size of the tissues and then organ due to decrease in the cell size and then cell tissue, then physiological atrophy, then pathological atrophy, then mechanism. Then coming to last, cellular adaptation, that is metaplasia. What is metaplasia? Definition of metaplasia, that is conversion of one differentiated cell type into other. What is metaplasia? That is the conversion of one differentiated cell type into another. For example, one epithelium get converted into another epithelium. One mesenchymal tissue converted into another mesenchymal tissue. But one epithelium never converted into mesenchymal tissue and one mesenchymal tissue never converted into epithelium. Okay, this epithelium to epithelium conversion is called metaplasia. Mesenchymal to mesenchymal conversion is called metaplasia. But epithelium to mesenchymal or mesenchymal to the epithelium never happen. So understand what is meant by the metaplasia, that is conversion of one differentiated cell type to the another cell type. Again, metaplasia is divided into two types: physiological, pathological. Okay. In the physiological, cervix during menstruation. Which type of metaplasia occur? That is the squamous metaplasia. Squamous metaplasia of squamocolumnar junction. This is the physiological metaplasia. In the pathological metaplasia, two types: epithelial metaplasia and mesenchymal or connective tissue metaplasia. Epithelial metaplasia again divided into two types, that is the squamous metaplasia, columnar metaplasia. In the squamous metaplasia, the most important example is chronic smoker, vitamin A deficiency. In the chronic smoking or vitamin A deficiency, the ciliated columnar epithelium lining the respiratory tract converted into squamous epithelium. Okay. The second example is when there is a presence of stone in excretory duct of pancreas, bile duct, salivary gland. In that case, cuboidal to columnar type of epithelium converted into squamous epithelium. Okay, these two examples comes under the squamous metaplasia. Then coming to the columnar metaplasia. Columnar metaplasia, most important example of columnar metaplasia, it is the Barrett's esophagus. In the Barrett's esophagus, squamous epithelium is converted into columnar epithelium. But there is important characteristic is there. Which type of columnar epithelium? It is the intestinal type of columnar epithelium. So, intestinal type of columnar epithelium मतलब इसमें क्या रहेगा? Goblet cells present रहेंगे. And to detect this, we use Alcian blue and mucicarmine stain, which detect mucin in goblet cells. Then mesenchymal metaplasia. In the mesenchymal metaplasia, one example is there, myositis ossificans, that is bone formation in muscle tissue. Okay, bone formation in muscle tissue. What is the mechanism behind the metaplasia? The first one is reprogramming of stem cells, and second one is colonization of different cell type from adjacent area. What is the meaning of colonization of different cell type from the adjacent area? See, it is a squamocolumnar junction. Here is the squamous cells and here is the columnar cells. Whenever there is colonization of these cell type into the adjacent area, when these columnar epithelium get converted into squamous epithelium, that is mean the colonization of different cell type from the adjacent area. And mechanism, there are two mechanisms in case of the metaplasia. These are all about the metaplasia. What is mean by metaplasia? Conversion of one differentiated cell type into another differentiated cell type. In metaplasia, physiological metaplasia, cervix during menstruation, and pathological metaplasia, squamous metaplasia in case of chronic smoking, vitamin A deficiency, and stone in the excretory duct of the salivary gland, pancreas, and bile duct. And in case of the columnar metaplasia, there is a Barrett's esophagus. In case of the Barrett's esophagus, squamous epithelium converted into intestinal type of columnar epithelium. So goblet cell present in that. So allicin glue and mucicarmine used to stain the mucin in the goblet cells. And mesenchymal or connective tissue metaplasia, that is the myositis ossificans, so bone formation in the muscle tissue occur. What is the mechanism behind the metaplasia? There is a reprogramming of the stem cells and colonization of different cell types from the adjacent area.